Good afternoon, good evening, good morning from wherever you're joining us today. Welcome to this 15th edition of our knowledge sharing series on public health interventions, the CCD Rounds. Thank you so much for joining us for what promises to be a really exciting discussion. My name is Joe Jewell. I'm Director of the Cities Changing Diabetes Programme, which is a public-private partnership hosted and supported by Novo Nordisk, but also involving a number of partners around the world. Over the past 10 years, we've been working with almost 50 cities in all different parts of the world, looking to address serious chronic diseases and looking for solutions at the community level to prevent these diseases before they start by working with the drivers of good health, including looking at the urban environment and the way in which the urban environment, the cities in which we live in, are having an impact on our health through things like our diet, the ability of us to be physically active, and also mental health. Today's discussion really cuts to the core of that topic. We've invited speakers to talk about how cities can put health and well-being at the centre of urban design. This is really the cutting-edge conversation that we're seeing around the world with cities as distinct as Paris, Milan, Bogota, Dakar, really looking at how they can put this conversation at the core of their planning, their horizon scanning about how they can be better ecosystems, better living environments for the people that they are intended to serve. As usual with this setup, we've invited key speakers to give us really their expert insights into what is going on in this space, what they think are some of the challenges, but also the opportunities to drive impactful change. And I'm really pleased that today we've joined forces with Urban Partners and also C40, two organisations that we work with really closely as Cities Changing Diabetes, to talk to us about the work that they're doing on this issue. Our first speaker will be Hélène Chartier, who is the Director of Urban Planning and Design at C40, a network of cities around the world known and admired for its work in engaging mayors and political leaders at the city level for driving change. And also Jesse Shapins, who is the head of Urbanism at Urban Partners, doing some amazing work that we know firsthand here in Copenhagen, but also beyond, looking at how really urbanism can engage communities and break down those barriers to health and well-being. So together, their presentations will shine a light on the concept of what we're calling green and thriving neighbourhoods, with examples of innovative projects that they're involved in around the world that are setting new standards for what sustainable urban living can look like in practice. Hélène and Jesse will present for around 30 minutes, which I'm really looking forward to getting really a feel of what we're talking about when we talk about green and thriving neighbourhoods. And then we'll go straight into a Q&A discussion where we can take questions from the audience and also bounce around conversation between Hélène and Jesse as experts in their field. So please do remember that all the way through the presentations that you can input your questions into the Q&A box, which is at the right-hand side of your screen. So as you're listening to the presentations and questions come into your mind, please do remember to note them down because they will come back to me and I'll be able to moderate a really engaging discussion with you around this topic. The first presenter will be Hélène, and then she will hand over directly to Jesse. So without further ado, I'd like to give the floor to Hélène, and thank you very much for joining us today, and I'm super excited to hear what you're going to present for us. Welcome.
Thank you very much, Joe. Let me share my screen now, up, so I can share my presentation. Up. Let me start from the beginning. Can you see my screen?
Yes, we can.
Yes. Okay. So let me try to give you in a snapshot an idea of what C40 is doing on this with this program of green and thriving neighborhood to accelerate climate action, community health, and well-being. So we know that the cities that has been designed around the principle of the past century are no longer fit for today. Actually, what has totally transformed the way we were planning cities is the introduction of cars in cities. When cars arrive in cities after World War II, they not only transform the public space, reducing space for people, space for nature, but they have also totally destructured our cities. So people didn't need anymore the proximity to amenities, job opportunities, and others, because they could jump on their car and cross the other part of the cities. And because of that, we have really pushed the extension of the city, promoting urban sprawl. And we have also planned the cities with an over specialization of city neighborhood, with residential area disconnected from a business district, disconnected from commercial area, and all of them connected by mainly cars infrastructure. And this has led to some of the the biggest challenge that cities are facing today. It has increased GHG emission, air pollution, but it also transformed the way people were living. And it has increased commute. So we have seen all over the world the time for travel increasing, but also creating poor quality of life in many neighborhoods, as many neighborhoods lack of amenities and social cohesion. So there is a global momentum, a global discussion happening right now to say that it is very important that we find our way back to urbanize in harmony with people and with nature. And especially as the urban population continue to grow, we expect that the floor area of cities will double by 2050. So where we built and how we built is going really to shape the world of tomorrow. So we need collectively to harness a model of low carbon, human scale and thriving urban environment. And that's where the concept of 15-minute city has been interesting, because it has really helped us to accelerate this discussion. The terminology of 15-minute city is not unique. Actually, all over the world, cities are using different terminology: city of proximity, 20 minutes neighborhood, complete neighborhood, vital neighborhood, and many, many others. But the principles are similar, with this idea of designing neighborhoods so people can find their essential need close to where they live. This is not really a new concept, and it's important to say it, I think, because since the Charter of Athens was been, if I can say, the original sin of urbanism after World War II, was act this car-oriented planning in the 20th century. Several urbanists, such as Americano-Canadian Jane Jacob, Jan Gehl, of course, in Denmark, and more recently Carlos Moreno, the French-Colombian Carlos Moreno, stood up to promote a new urban model, or better urban model based on proximity and people-centered public space. So why this approach is important? It's important because it can be an accelerator of climate action, and it's interesting because now we have clear evidence that this model could help us to reduce GHG emission. So latest IPCC report, which is, if I can say, the Bible of the climate expert, place actually a particular emphasis of this idea of proximity and better spatial planning, indicating that if cities adopt this model now, we could reduce GHG emission by approximately 25% by 2050. So a very important contributor. So the cities are now familiar with these ideas, but they also push the agenda because they see in this agenda a way also to improve the quality of life of their residents. I think it's also very important, and I think especially in this conversation today, to say that it is an accelerator. We believe it is an accelerator of not only well-being, but health for the local community. Because it's about reducing the use of car and improving air quality. It's about, if we reclaim space from car, it's about growing green space and urban nature in the cities. Also, it's also about harnessing a more family-friendly urban environment and lifestyle with parents who can have less commute and public space that are designed around the need of the family and the children especially. And it's also about bringing health services close to where people live. And on this latest point, I want to, for example, mention Paris, for example, was pushed this concept of 15-minute city. One of the pillars of their program is to develop a health center in every neighborhood of the city where the people can find basic health services very close to their residents. So this approach is very important. It's also, and I think it's important to say it, a matter of equity, because the reality is that a lot of neighborhood are already 15-minute city or are already designed around this key principle, but they tend to be in city center or in the wealthy neighborhood. So all of the focus now is to say that we need to integrate this principle not only for these central and wealthy neighborhood, but for all of the neighborhood, including the suburban and the metropolitan area of the cities. So it could not be a design for privileged population, but a mainstream approach of planning. So what is a little bit more this concept, and what are the key principles of this concept? So I think what we try to explain here is to try to move from a monocentric cities. A lot of cities as these very strong mixed-use, compact central neighborhood, and then it's very monocentric, and and the rest of the cities is a little bit less align with this principle. So move from the monocentric to a polycentric cities, which would be made for several or multiple complete and walkable neighborhood, which means that in every neighborhood you have a mix of people with a variety of housing option for the variety of the population, a mix of use, including especially the amenities, services that people need for enjoying the urban life, but also the importance of the public space, which is really the hyphen of the city, the hyphen of the different components of the city, and could be seen as the living room of the neighborhood where people can meet, socialize, and of course easily walk and bike. And finally, by reclaiming some of the space that has been dedicated to car, harnessing increasing urban nature to create more livable and healthy urban environment. So these are the four main principles. And I wanted briefly to go through this principle, and I'm sorry, my slides are very wordy, but just to give a snapshot, a little bit more detailed information and an idea of how cities have turned this concept into reality. So this concept of complete neighborhood, of course, we know that it's also very important to this come with a certain level of density. You can't have job opportunity, you can't have services and infrastructure viable if you don't have the minimum of density. So making sure that the minimum of density and mixed use are everywhere and not only in some of the neighborhood. The proximity and the decentralization of the city life, the activation of the ground floor, and also to try to avoid single-use building and foster more flexible space that could help to create more active neighborhood. The city of Vancouver in Canada has, for example, recently revised its main urban planning document and have base all of the strategy around this idea of complete and walkable neighborhood. And they really, it's very interesting because they identify what the cluster of local shop, flexible workspace, and they try to increase this type of function in the neighborhood that were missing. They try also to incorporate more missing middle housing for different typology of family and household. The second key principle, it's also this idea of not only we need to have not only the past model have created an over specialization of neighborhood by function, but also a segregated approach of cities. And we believe that a good city is also where in each neighborhood you have a diverse mix of people. So making sure that in every neighborhood there is an equal access to housing option, and especially affordable home. And many cities across the world, from Johannesburg in South Africa, for example, or again Paris, are trying to now secure a certain amount of affordable housing, not only at the city level, but in each of their neighborhood, And I think that's very important. This inclusive and cohesive community, it's also about engaging with the community, to work with them to shape the priority action for their neighborhood. And the example of Los Angeles with this project called What's Transformative Communities is exactly that. It's one of the poorest neighborhood of the city, and they have really worked closely with the community to shape a set of action to improve the sustainability and the quality of life in the neighborhood, and they have raised a lot of money, of funding to implement this project with a lot of success, and also creating within a neighborhood some place dedicated for social interaction. So we try to tackle also loneliness in cities. The third key principle is, of course, the public space. I was mentioning earlier how public space is important for a neighborhood. In cities, most of the people doesn't have a garden, doesn't have external outside place. So it's the public space that will become their garden, their living room. So it's very important to design a public space around the need of the people, not only to foster active mobility, walking, cycling as a first mode of choice, as a Nordic country, for example, has probably been a pioneer, but also making sure that the public space incorporate use for social function, community building, and urban nature. A lot of cities around the world, I mentioned here Bogota in Latin America, but we could mention, of course, Superblock in Barcelona, Piazza Aperte in Milan, and many, many others who have decided to accelerate their action, their transformation of public space through a tactical urbanism approach, which has been very successful to inspire, to work with the local residents, and to do a form of planning by doing. So this transformation can be smooth and adjust to the needs of the local population. The fourth and latest principle for this model, it's really the importance of nature. We know that nature is a key tool to increase quality of life and well-being and health, but also to reduce risk to climate events. For example, in case of extreme heat, we know that neighborhoods that incorporate nature could have 6 degrees less heat than a very gray and neighborhood with a lot of concrete and gray surfaces. So a neighborhood should incorporate nature, and we think there is 3 levels of nature that should be considered. The first time is having access to a large open green space, a large park for sport, for biodiversities, and that within a 15-minute walk from home. The small pocket park also that are very important for family, children, especially for the daily needs of the community, and what I call the green throughout strategy, which is about bringing green space everywhere in the streets, on the walls, on the roof, so it can really help to create a more climate resilient urban environment. All of the cities across the world, it's really a major push, are trying now to incorporate these policies and to replant in the cities. Buenos Aires in Argentina, has been one of the key cities to do that, and to accelerate. Other cities like Medellin in Latin America, for example, has been also accelerating their agenda. So these are the key principles. The idea, the concept of the 15-minute city I was mentioned is not really new, but since the pandemic, there have been a global momentum. And actually, if I may say, I think the C40, the organization I'm working for, has been very instrumental to accelerate the discussion and to push this agenda globally. We have been the first global organization in 2020, early 2020, at the very beginning of the pandemic, to support the concept. We have been contacting Carlos Moreno, organizing event, webinar to promote this concept. And it has especially been supported by what we have called the Green and Just Recovery Task Force, a task force of Meyer, who has been helping city to recover after the pandemic. And thanks to the support to key partners such as Urban Partners and Novo, we have now created a dedicated program that we have called Green and Thriving Neighbourhood, and that aim to accelerate this good urban design, urban planning approach. We try to accelerate our action around three key pillars. The first one, it's really about sharing knowledge and best practices. We have created a forum of cities who are sharing activities together. So we have weekly webinars. We have a regional workshop. We have done one in Europe, Latin America, North America, and of course we are participating to public events. We have today 45 cities who are actively part of this forum. We are also trying to provide direct support to cities to implement neighborhood pilot. And finally, we are trying also to join force with partners, with other key partners and thought leaders who are pushing the same agenda. So Urban Partners, Novo, UN Habitat, Europe, GALE, and many others. I was mentioning the pilot. So we have now 22 pilots that C40 is directly supporting, thanks to Urban Partners, Novo, and all of the partners that we have we are working with on this program. Some of the projects are existing neighborhoods that need to be revitalized, transformed. Some are new developments, and as you can see in this map, they are really happening in all the different parts of the world. We are also trying to accelerate the knowledge sharing. So we have created a 15-minute city initiative explorer, gathering all of the policies, initiatives that cities or other organization can develop. So this is online. It is open to everyone, and we have joined force with UN Habitat to create a platform that is called the Global Observatory of Proximities, to be a form of go-to knowledge platform for academics, researchers, and others to find all of the information about what's happening around this momentum. And finally, we are working very closely with Novo Nordisk to try also to make the case. And to make the case, we need to measure. And I think it's very important. So we are developing, it's almost done now, a tool to help cities and stakeholders to measure the impact of a good urban planning intervention, especially the 15-minute city approach. we are working to measure the impact, especially on health, but also on social economic aspect and the GHG emission. We hope to launch this new tool. We are piloting the new tool right now with several cities across the world, and it's going to be launched in January, so stay tuned. I think it was my last slide. I tried to give you a quick snapshot about our activities and this agenda. Thank you very much for your attention, and I'm very happy to turn the floor over to Jesse now. Thank you very much.
Amazing. Thank you, Hélène. And that's a perfect segue to what I was going to share with everybody here. And it's great to be with you all. I'm speaking from a rainy, cold, but wonderful Copenhagen. So I'll go through a very kind of quick presentation here to make sure we have a lot of time for discussion around how we're actually putting this sort of green and thriving neighborhoods approach into practice here in Copenhagen, and sort of the broader backdrop for how we think about this work related to preventative public health. And so to start, just a little bit of a kind of story for how we think about neighborhoods as a platform for prevention. And this really builds on what Hélène was already sharing in terms of the evidence that shows how urban planning and climate action can really have meaningful health benefits for people. And as has already been spoken to, this really is, and I think it's important to underscore, a highly collaborative effort, and it's sort of a really important kind of global movement that we are all working within here. And what I will share here is certainly myself speaking from Urban Partners, but it is really also on behalf of this partner group that we've put together that is really driven forward this work with very great collaboration with Cities Changing Diabetes and Novo Nordisk, but also Gale, C40, COBA, and ourselves. But I think, just to kind of give a brief outline, I think when we typically think of new neighborhoods, which is what I'll focus on here, we typically think of the planning of the streets, the buildings, the infrastructure, the green spaces, sort of all those sort of classic physical infrastructure elements. But I think all of us that sort of experience cities know that it's much more in a neighborhood than just those physical elements. They do matter, but it is also the places where we have our sort of food and drink offerings. It's where we're meeting our friends. It's obviously our neighbors and local community, our favorite businesses, places even to be alone as we need to. And I think it's this whole range of experiences that neighborhoods afford that really makes them such important places for urban health intervention. And I think when we look at then the kind of trajectory of health more broadly, I think we can sort of see ourselves moving into what we might call a kind of health 3.0 paradigm, where sort of the first kind of health 1.0 was the more kind of traditional clinical prevention, very much focused on sort of the care for the sick. There's obviously been innovation around clinical prevention itself and services outside the clinical setting. And really Health 3.0, and again, Cities Changing Diabetes has been at the forefront of this, is leading this idea of preventative public health. So actually working at the kind of community-wide scale, proactively addressing social and environmental determinants to actually prevent and promote better health. And what that looks like in a kind of urban setting then is actually moving from sort of this model in a way. When we think about health historically in a city context, we started looking at it really through the kind of care system and the institutional anchors of that. So your hospitals, your general practitioners, your specialists. This, if you were to think traditionally about health in the city, this would be the sort of picture of the city you would have. And I think this approach basically moves us to say there's opportunities for public health in all the everyday places that we come into interaction with: our streets, our bus stations, our community centers, our parks, our bike infrastructure, grocery stores. All the spaces and sort of areas for intervention that Hélène highlighted make up sort of the palette for green and thriving neighborhoods. And that is, again, to underscore why we really see this as such a powerful linkage between the climate action that Hélène spoke to and the health benefits that we believe this can create, and really focusing on how do we actually use urban planning and design to kind of make sort of the healthy choice, the easy choice, and making spaces that really promote that type of everyday behavior for the widest range of people. And so moving into the concrete example of Jernbanebyen, or the railway district in English, this is sort of this major project in Copenhagen that we have underway that is transforming former rail yards into a green and thriving neighborhood. And so to give you all a little bit of context, on the aerial map here, you see sort of Copenhagen as a city. In the center there is sort of the historic center city, that goes back into the medieval period, and then all the kind of surrounding neighborhoods. What you see here with the kind of shape outlined is the area that is the railway district, or Jernbanebyen. And it really is, as you can see in this map, the largest undeveloped area in central Copenhagen. And this is what it looks like from above today. So it's an area that was sort of the freight rail yards, where there were also many historic buildings for maintenance of rail infrastructure and rail, trains and such from the state railway company, as well as other sort of uses. And sort of as the city has transformed and the economy has transformed, those rail uses have sort of been discontinued. And thus it has become the area ripe for transformation into a kind of green and thriving mixed use neighborhood. And so this is sort of the picture of what you can see in the future, where we're taking this existing space and transforming it into a place for about 9,000 residents, 4,000 jobs over the next 15 years. I'll get into much more detail about what this actually includes, but you can see it's a very wide range of uses, very much sort of taking the approach that Hélène spoke to in terms of having a whole range of people and inclusion with a significant percentage of social housing, but also preserving as many historic buildings as possible, creating community centers, integrating local groceries, a whole range of amenities and services, and really strong connections to transportation. You have the metro that is just blocks away that is opening next year, as well as other major transit spaces. So no strong reliance on cars required. So this is sort of then the way that we start to think about urban interventions. And we do use that word intentionally, sort of taking the notion of these being interventions that are intentionally designed to promote health. And there's sort of 5 then pillars to these interventions that we have in terms of the partnerships, green space, the people-centered streets, climate, and the overall community mix. And I'll go through each of these really, really quickly. But the foundation, in a way, we believe, for taking this approach to community-wide neighborhood health, it does really require a partnership model. It can't be done by one single actor alone. So Urban Partners ourselves, we are a kind of investor and developer working from the private sector, but working in very close partnership with the municipality of Copenhagen, other major actors in Jernbanebyen, the historic landowners, the state real estate company, the state railway company, other investors such as Novo Holdings and the state pension fund, as well as then a range of global actors, groups like Cities Changing Diabetes and C40 and others that you've heard mentioned, but then also, and I'll get into more detail, very local community actors within the community hub that we've started to establish at the center of the neighborhood. And then building from this partnership approach, we really focus on the green side. And so this, for us, as you heard from Hélène, the green very much includes nature, and it's a proven stress reducer. It's something that's also very important for climate resiliency. And in this neighborhood, we'll have about 10 hectares of parks, much more than your average new neighborhood in Copenhagen, made up of a whole range of different scales, as Hélène spoke to, sort of larger sort of neighborhood-wide parks that allow for outdoor activities, but some that are smaller for community gardening and other uses. And then the streets become a critical part of the green experience. We see these streets as spaces for social life and nature. And in regards to health, this allows for much more active movement by not having to rely on cars. And the way we achieve this, there are still cars that are sort of used in the area, but they're kind of concentrated in mobility hubs on the periphery. So all kind of parking and shared mobility is in sort of sites that are on the edge, making it possible for the interior of the area to be really designed around walking and biking in nature, like you see in this picture here. And then on the climate side for the green, we really work at a neighborhood scale. You have an opportunity to do different types of district systems that can really help with reducing CO2, but also improving air quality. So looking at sort of ways that we can have district-wide heating and cooling that actually expands and integrates with the area systems, and actually ends up producing more clean energy than you would have just in the area alone. But then on the thriving side, it is such an important part for us to really integrate the environmental agenda with the social. And one of the things that's really unique about this is it really is a neighborhood that from the beginning is being planned and designed as a truly mixed community-oriented neighborhood. It'll have 25% social housing, which is actually, even in a Copenhagen context, which is, I think, internationally understood to be quite a socially progressive city, unprecedented for a new neighborhood development. The most recent new neighborhood developments at their largest max have achieved about 10% social housing. So this is a huge step in terms of, from the beginning, planning for a whole range of incomes and housing mixes from the beginning. And actually then integrating that housing with education, play, work, and healthy food. So on the health side for the food, we've been very active in intentionally meeting actually with any prospective supermarket. We know we will have supermarkets. They're obviously an important part of the area, But if you're to open a supermarket in this neighborhood, it has to meet a certain health standard. And that's something that we're actively engaging in and setting as requirements in our lease contracts with the prospective supermarkets. And then zooming in even further, while that sort of gives you a picture of the long-term plan and transformation of Jernbanebyen, for us, it's also very important to already start to put this into practice now. And that's about the space 410 that is itself what we call a kind of healthy social infrastructure lab. And so here's again a picture of the future state of Jernbanebyen, and you can see this circle around this area right now. And that is sort of this existing rail building that is transformed into the future community hub. And so that community hub is really supporting the community through a whole range of programs and activities focused on food, physical activity, as well as mental health and social connections. And rather than waiting to do that at the very end, we said, let's actually do this now, working with the existing building to build the whole kind of neighborhood and identity of the place around this by really also testing and learning how we work with health in a neighborhood context. So the approach then for this kind of social infrastructure lab is really to kind of work with this existing space now and test and learn how we can actually measure healthy social infrastructure. Think about Jernbanebyen as a whole, actually the living lab for this approach to healthy neighborhoods and how to actually prevent and promote health, but then also feed that knowledge into this global movement. And of course, to take learnings from this global movement back into Jernbanebyen and into Sporty itself. So this, as I said, is sort of the key pillars of how we look at this healthy social infrastructure. It is very much food, physical activity, social connections, and democratic participation. Again, many of the themes that you heard from Hélène that are sort of the pillars of how you approach a kind of 15-minute city or green and thriving neighborhood. And this starts to give you a picture of what this is like today. So on the food side, we've had the exhibition and masterclass that Gail and Novo Nordisk have put together around foodscapes, really helping communities understand and put into practice the ways in which the built environment can promote healthy food choices within the way that there's access to healthy food in your everyday life. It includes actually coming together around healthy food, communal dining as an anchor to the experience. This happens every single Wednesday in this space. Where at an affordable price, people can come together and get a really healthy meal as they're part of a range of other activities in the building. And physical activity is a huge part of this space. And it's not just sort of the classic sports activities, but really providing space for a lot of local nonprofit associations that are working with, say, rollerblading or scooting or boxing with young kids, that are things that are not really typically supported within the traditional spaces of the city, and using the outdoor spaces also for other fun social activities that are also physical, like salsa dancing, gymnastics, and other sports. And around all this is very much the social connections. And so we have nonprofit organizations like a group called Cycling Without Age, this picture you see here in the middle, that works with different types of bicycles to actually get elderly people out with each other in the streets of the city, hosting events that bring together different communities, young kids with our maker workshop to build kind of little bee houses. There's a group called Plug-In that works with actually sober dance parties like this one you see here, as well as ice bath and sauna for mental health. So a whole range of different activities in a play for all ages space that IKEA has put together in this space. And then again, also using this as a place for democratic participation, both into what this healthy social infrastructure lab could be in the future, as well as the long-term neighborhood transformation. So really seeing citizen and kind of citizen involvement and engagement, not being something that just happens through your traditional public meetings, but actually doing it in a space like this that is itself a kind of embodiment of the democratic ethos of the project as a whole. And with that, I will end with sort of suggesting that we watch one little brief video of an event that we had when we opened up the space for the first time at the end of May, just to give you a sense of what this is really like on a day-to-day basis here in Copenhagen, and what can hopefully be inspirational for projects in other parts of the world. If you could play that video, and then I will say thank you, and we can move to Q&A.
Allerførst vil jeg sige, at uagtet om man er født og opvokset her i København eller er kommet hertil senere, så har der altid været noget meget, meget fascinerende i at tage gaden tilbage.
thank you. And that hopefully gives you a sense of the space and this overall approach to health in neighborhoods. And back to you, Joe, for the Q&A.
Thanks, Jesse, and thanks, Hélène, for really great presentations. And I can't think of two better people to present and encapsulate what we're trying to achieve with the 15-minute city concept, or the Green and Thriving Neighbourhoods concept. I mean, really, I think it came across through both of your presentations how this concept and applying this concept in practice really has the ability to contribute towards both environmental, social, and health goals simultaneously. And I think that's potentially the beauty of it, in the sense that it brings agendas together. By making cities more livable, we're actually also achieving multiple goals in the background without a lot of thinking goes into it, but like without people having to think about it so much. And I think that's the beauty of it as well. By designing cities in a way that they become more healthy and sustainable, that people are able just to live healthier lives in general. I want to start with a little bit of a challenging question, I guess, in the sense that many people participating on this webinar think this is a great idea and let's go with it. But it's not a topic that hasn't been without some scrutiny and some criticism in media from politicians, and so it would be useful just to understand what some of those potential critiques are, and actually how you counter that and present the counter arguments. So let's say take one argument around gentrification, or that it's only benefiting a number of wealthier communities. I think, Hélène, in your presentation, you highlighted, well, some of this is actually naturally happening anyway in city centres and wealthier neighbourhoods. But how can we demonstrate that the work we're trying to do through the 15-minute city and the Green Thriving Neighbourhoods movement is actually going to benefit vulnerable populations or close that equity gap? Just interested to hear both of your perspectives, actually. Hélène, I'll come to you first to talk about what is some of the political dimensions of this issue, and how do we actually sort of counteract that with positive arguments?
I think it's a very important topic. And if I take like what we hear, what we work with on this with cities, I think the first thing is that city, contrary at what the press and the media sometimes focus on, like the example from the city center in Paris, or actually the 22 pilots, for example, most of them are in neighborhoods that are underserved, low income. So basically, I think Myers knows that the idea, the real challenge, is to make sure this is happening in every neighborhood. And that, and so I could provide a lot of example from the 22 neighborhood we are working on, but this is very important. If I just take the example from where I live in Paris, actually we know that the city center of Paris is not anymore a topic. I mean, there is still improvement to be done and everything, but for example, the city of Paris has put in place a few years ago a program to help revitalize local shop. So basically, the city buy or preempt some of the vacant shop in underserved neighborhood to try to help bakery, bookstores to install, so you can have this thriving local life in this type of underserved neighborhood. It has been a great success in the city of Paris, and now they try to develop that at the metropolitan scale. So now it's really, there is a program called revitalization of the city center. So around Paris, you have 180 different cities, smaller cities. And the idea is to make sure that the city center of each of these small cities, that makes the beauty of the greater Paris, so you have this polycentric development of the cities, is supported. So we keep these centralities with the church, usually that's the way it works, and a few local shops at the public space. So there is this program to help stress and reinforce this centrality also outside the city center. I mentioned the example of Bogota and others. The second aspect, and I think it's very important to say, is that I think one of the pillars, and I think both Jesse and I mentioned it, it's also the housing option. So it's not just about the amenities and the mix of use, it's also about the mix of people. And there is more and more cities who are taking action on that, and that making sure that in each neighborhood, they try to secure a certain amount of affordable housing. In Paris, again, there is a national law that say that in every city you need to do 25% of social housing. It's a law, otherwise the city pays some tax. But actually now the larger cities start to say it has to be more spread across the city. So it has to be not at the city scale, but in each neighborhood you have to have this 25% of social housing. I think this is very, very important. And during the COVID crisis, for example, we have seen the debate coming about the essential workers. Why the essential workers have to cross the city? So making sure that in every neighborhood you can keep the housing for the essential workers that will work in the neighborhood and that are so important for the life of the neighborhood.
Thanks so much. And Jesse, I mean, maybe you have some additional perspectives. And in your presentation, you also mentioned the aspect of democratic participation, so community involvement in decisions that affect them. How do you see that helping to overcome any challenges along the way as well?
Yeah. No, I think on the equity topic, which I think is critical and foundational to this work, I think there's maybe a couple of things to point out in sort of what I was sharing here. I think one is in a new central city neighborhood development project, I think it becomes incredibly important that you have intentionality to have people that are maybe coming from more kind of historically underrepresented and marginalized backgrounds actively involved from the outset and feel a sense of belonging in this place. I think that in many central city neighborhoods that maybe is not, especially in Europe, the populations that you think of first and foremost to involve. And I think a project like C40 gives us the opportunity to actually work with those communities and not just do it from a kind of show up for a public meeting, but actually create a space where there is a sense of home and belonging for those activities. And that's what you saw in terms of the many different actors and nonprofit associations that are already a part of the space. And I think it's very different than the traditional development model in terms of the types of uses and people that you're bringing in from the beginning. And then I think the other side to this is that, that's sort of what can take place in a new neighborhood development in a central city location. We also, as an organization, are very active in a kind of socially challenged area in the outskirts of the city. And in an area like that, examples like Hélène was sharing in the metropolitan Parisian context there, I think it becomes really important for private sector actors to also take initiative and contribute and to help, and in our case, in many ways, take a similar green and thriving neighborhood approach. And in that case, it was about an existing neighborhood, introducing retail options, bringing a local grocery store that hadn't existed historically, actually working with the social housing companies in partnership to introduce new housing options that also weren't exclusively social housing. So you truly have a mix of options in a place. And so I think there's a really important relevance to kind of the equity side for both existing neighborhoods and new neighborhoods and taking learnings and integrating across both. And I think what's important also is it's worth acknowledging that in some cases, the neighborhood concept honestly has also been extremely exclusionary. Take the North American context, like the suburbanization of Long Island and the early suburbs were basically designed in part to be able to create exclusive covenants that said only certain types of people could live in those communities. And so I think we have to be really careful with neighborhoods that they're not only for the people also that live and work there, which is, I think, a really important piece, but that they're places for the city as a whole. And that's, again, what something like a C40-like space achieves, is it's a space for the local residents, but also integrates and connects with people from around the city. And so when we think about the neighborhood, it has to be at all those levels, as who lives there, who works there, and the city as a whole as a place that also is sort of invited and welcomed into the place.
Super. Thanks for those really good answers. I'd just like to remind participants that we do have the Q&A function, and I can see some really great questions coming in, so please do continue to submit your questions. One of the questions that we got from an audience member relates to capturing the impact of these efforts and initiatives that you've been describing. I imagine that can be quite complex and challenging at times, but how do you look at the question of monitoring and evaluating the impact of the initiatives as a whole and individual parts of it? And is that something that both your organizations are giving a lot of thought to? Let's start with Jesse this time.
Sure. So it's I think it's an incredibly important topic, and it's one that I would say we are really actively working on, but do not yet have the solutions to. I think I'm very excited about the tool that, Hélène, that you just mentioned that you've been developing with Novo and us being able to pilot and use that. I don't think we have the type of practices yet around this type of social and health impact in urban neighborhoods that we do around the environmental side. There's been the last sort of 10 to 15 years of buildup of capacity and knowledge of how to kind of measure CO2 or use different proxies to measure CO2, to understand what a baseline is, to understand how you are sort of mitigating that. We don't have that same knowledge yet in terms of, I think, the sort of this preventative side of health and the relationship to planning and design and social impact. I think we're building it, but that's one of the topics I think is most important, because that's also the thing that will allow for the scale to really be achieved. And also from my seat as sort of sitting in a private investment perspective, I'm also really interested in being able to make the case that shows that this is achieving that impact and there's measurement behind it. And it is also linked to long-term economic value and economic mobility. And that's something we've been able to see. That neighbor I was mentioning, the outskirts of Copenhagen, it has been a longer-term project. We've seen meaningful change in the socioeconomics without a change in the residential population. Mm-hmm. So we do have some of those data points that have been really powerful. Here at Sporty, it's just still a little too early, but getting these tools and models in place is one of the things I think is most important for us to do now.
Great. And Hélène, coming to you, I mean, just picking up on that point that Jesse was mentioning around, okay, so maybe some shorter term or intermediate indicators versus the long-term goal and ambition of what you're trying to do. How does C40 think about this challenge as well?
Yeah, so I think it's very important, as with everything we do at C40, we try to be a little bit data-driven in our approach. So for example, for the 22 pilot, we have put in place a methodology where we basically first help the city to analyze the neighborhood, or analyze if it's a new neighborhood, like a similar neighborhood in the city, to have a baseline and to identify what are the key indicators. So we have set for the 4 principles that I mentioned what we think are key indicators that the city need to monitor. Of course, then we shape the specific indicators for each of the pilot and the context of the city. And we help with the city to define the action with the community based on these baseline and analysis of the neighborhood. And we are working with them to try to follow some of these indicators, both in terms of social, so for example, how public space is used. We are working now to try to see how we could also make sure the local business are thriving with if there is an intervention. So we are also developing this tool with Novo Nordisk, which we think is going to be very important to measure the impact of urban planning. Because, for example, sometimes when you measure the impact of the GHG emission impact, for example, of a neighborhood, you measure the impact of each of the building or the transport, but you don't measure the impact of the urban fabric. And actually, as I was mentioning with the IPCC report, a good model is already very important to create, to allow emission reduction and everything. So this tool will go in the detail of this to measure, while we define the action, while we design a neighborhood in case of a new one, how this will impact the health impact and in the future GHG emission and others. So that's a very important topic.
Super exciting. I can also see that a couple of questions are coming in around food, Jesse, and you mentioned in your presentation with regard to Jernbanebyen that food is a key pillar of the work that you want to do there. And a couple of the questions here, really appreciating the fact that there's going to be a focus on food, and that the issue of access to healthy and affordable food is an issue for particularly for low-income communities. Then the questions are getting into the tricky part about the practicalities of actually doing that. And one of the questions is asking about how are you actually anticipating working with businesses, retailers and services that come into that area to ensure that they do provide healthy food. And maybe you don't have all the answers now, because I can imagine that's a tricky question, but how are you thinking about addressing that challenge?
Yeah, I mean, I think that at the macro level, I think one thing that we are trying to put into practice is thinking about an urban food system in a similar way to the way that we think about other classic urban systems. So when we do urban planning, it's very well established that you think about your mobility system. How do people get around and all the different modes of transport, your energy system. And I think a food system is also sort of similar in terms of it is comprehensive in the neighborhood. And I think what we're looking at then strategically is how do you think about all those different touch points that people might have with food? So that doesn't just include the local grocers, which is sort of the first thing you go to, and that matters. And as I mentioned, it's maybe almost the, not to say the easiest, but is one where it's sort of, we are a kind of property, owner, and therefore we are having tenants, and we will be able to have some sort of dialogue and structure around how we structure those tenant agreements, which gives us some opportunity to kind of actually codify and have some sort of teeth around what health means in terms of the offering. Not to say that's easy, that's a challenge to get grocers to kind of push farther, but we have some sort of context in which to do that. The other areas is sort of also, the offices, the canteens that serve many of the people that work there. There's an elderly care home. There's social housing that also has communal dining spaces. So I also think expanding our kind of mindset for where food experience takes place, and that's what I love about the Foodscapes work, is it says that the food is part of this overall urban landscape. And so, and as far as affordability goes, it means also being able to provide access to affordable food options that aren't just about sort of the food options that you have in your grocery, but there are other meal options that you can provide. Obviously, also a critical piece of that is the schools. There'll be schools and daycare centers that are in this neighborhood. And so working with the municipality of Copenhagen on how do you ensure that there's healthy food in those places, which they're, have a major agenda around. So I think the summary of that is, practically speaking, it's not easy, but it's one of those areas where I feel like there's a growing understanding of how can we actually take a systems-wide approach and look at all the different touch points that people have with the food system and understand how can you actually promote healthy, affordable food in all of those opportunities for interaction.
Super. And we're running out of time, but Hélène, I have time for one very brief question to you, which is combining a number of questions that have come in around, okay, quite a lot of focus in our presentations has been on examples from capital cities. Are we planning on implementing in smaller secondary cities? And also globally, where are some of the sort of not low-hanging fruit, but priority areas to work in? I mean, if you can give me in 30 to 45 seconds, just a brief snapshot answer on that, it will be super helpful.
I think it's very important, the secondary and tertiary cities and towns. So I think actually this model it worked very well. There is no reason why it would not. And actually there is a lot of town, especially with the development of train in different countries that have become dormitory town. People were living there because it was less expensive than the capital where there was a job opportunity, and they were basically spending 2 hours or so. In France or in many countries, you have these cities that were not too far, for example, for Paris, who become this term of dormitory. The concept is also to say this is not okay. It's not okay for a neighborhood in the suburb. It's not okay also for a city. So it's also about bringing these job opportunities, these thriving local life also in the secondary cities and everything. And a lot of government are working on that. And I think with the development of flexible working and everything, there is an acceleration also on this topic that might be a threat, let's be honest, but that also might be an opportunity to reinforce the secondary and cities in the different countries.
Thank you so much. Thanks so much to both of you for a really excellent contribution today. Great participation from the audience as well. Time is up, but before we go, we will be able to make this available on our YouTube channel. Please, you'll see an email address coming up on your screen that you can contact if you have any questions for our speakers. And of course, visit our partners' websites, Urban Partners and also C40.org to have a look at what they're doing. Our next CCD round will be coming up on the 19th of December, where we'll be hearing about the Move for Fun program on physical activity. So thanks again for participating, and watch out for the next upcoming session, which we're really looking forward to. Have a great afternoon and great evening wherever you are. Bye.